Today's episode focuses on anxiety within university students, presented by Alice, Chloe, Kelsey and Alice.
What is anxiety? Anxiety is defined as a natural emotional state which revolves around feelings of fear, worry and stress. Anxiety can come in many forms, two being social anxiety and phobias. Social anxiety disorder is the most common type of anxiety. Stein 2008 found that it affected 80% of individuals by the age of 20. It can be separated into two subtypes, specific and generalised. Generalised is the fear and avoidance of a wide range of situations, and specific is the avoidance of particular situations, for example, public speaking. A study done by Jeffries 2020 was an online survey which was sent out, including questions about social anxiety, resilience and social media use. Participants were randomly recruited by national research panels. There were 6,825 participants involved in the study. 3,342 of these were male, 3,428 female and 55 others, all aged between 16 and 29. The participants ranged from countries such as Brazil, US, Thailand and Russia. Participants got sent an email invitation for the survey. The survey included a self-report social interaction anxiety scale. The results showed a normal distribution with a positive skew. 1 in 3 were found to score above the threshold for social anxiety disorder. It was also found that there was a significant score between people in employment and unemployed. People who were employed had a lower score compared to those who were unemployed. I'm now going to speak a bit about phobias. The NHS website defines phobias as an overwhelming and debilitating fear of a certain place, object or situation. The symptoms come hand in hand with symptoms of anxiety such as nausea, sweating, increased heart rate and shaking. There are two different types of this: specific, which is based on a specific situation or object, and complex, which tends to be more overwhelming and disruptive on an individual's life. Mind 2019. A study completed by Stewart in 2007 used the social phobia inventory, which was invented by Connor 2000, was used to identify social phobia symptoms of two groups of students. 59 who attended the counselling centre for help and 119 who were participating in the research study. The results were high in both groups of students, with the clinical sample having a slightly higher mean. This suggests that students who seek help are more likely to notice the symptoms of social phobia than the students who don't seek help.
I will be explaining the causes of anxiety for individuals to better understand where it comes from and its effects. People have not been able to fully grasp the causes of anxiety. Life events like traumatic experiences seem to trigger anxiety disorders in those who are already susceptible to it. However, anxiety can also be inherited. For many individuals, anxiety can be correlated to an underlying health problem. In many instances, anxiety signs and symptoms are the primary indicators of a medical sickness. If your GP assumes your anxiety has a medical cause, they can arrange tests to look for a problem. Medical issues which can be linked to anxiety include heart disease, diabetes, drug misuse or withdrawal, and more. In many cases, anxiety can also be a side effect of certain medications. It is also likely that your anxiety results from an underlying medical issue if, for example, you didn't have an anxiety disorder as a child. Similarly to many mental health disorders, researchers are not aware of what causes anxiety disorders. However, they believe a combination of factors are involved, such as environmental factors, severe or long-term stress. Similarly to many mental health disorders, researchers are not aware of what causes anxiety. However, they believe a combination of factors are involved, such as environmental factors. Severe or long-term stress can alter the balance of neurotransmitters which are in charge of your mood. Undergoing a lot of stress over a long time is associated with anxiety. Experiencing a distressing event can also participate in anxiety disorders. Another website had shown that drugs contribute to increasing anxiety. The effects of caffeine and alcohol on the body is able to make individuals feel anxious. Legal drugs also contribute to having an effect. It was found that about 20% of those with anxiety also have a substance use disorder. However, there is no single cause of anxiety. Genes, environmental influences, personality and life experiences all play a role. Although it is true that major stressors, like abuse, increases the risk of anxiety, and genetic factors may be produced from stressful events, and personality traits can put us at risk of anxiety, For example, those who have low self-esteem, poor coping skills and a tendency towards neurosis or harm avoidance are more prone to anxiety.
So I'm going to go over a few of the correlates between anxiety and university. I'm going to reference a few studies to explore the causes and effects of anxious experiences for students. So of course the transition to uni is a really dramatic life shift for many people, and aside from the stresses of increasing academic and financial demands, many undergraduate students in particular, they face somewhat of a loss of constant access to these fundamental support systems that they were previously reliant on. And this is, especially prevalent for those who are transitioning to uni immediately from their last year of education. And it's widely recognised that rates of anxiety as well as chronic stress, depression and other mental health issues substantially increase in this period, and these high rates remain throughout university education. So a study published in 2005 by the American Journal of Osteopsychiatry looked into the levels of depression and anxiety in university students, conducting an online survey to do this. So it was reported that 44.3% of undergraduate students, when reflecting on the 4-week period prior to completing the survey, that their own mental and emotional health had a noticeable impact on their academic performance. So this was also reflected in the 18.4% of these same undergraduates who reported missing academic obligations within this time. Of course, the statistics from this study are quite outdated, having been published 20 years ago, and so despite offering insights into the correlates of anxiety and academic performance, the figures are not necessarily an accurate reflection of this today. So it's important to consider the drastic technological advances which have altered the teaching of higher education since 2005, and the current cultural climate with the implications of COVID and inflated cost of living, just as a few examples. For a slightly more recent comparison, a similar study was conducted with students at a large university in Toronto in 2019, published in the International Journal of Mental Health Symptoms. So 148 participants completed a self-administered online survey where they rated these so-called exposure items on a scale of 0 to 7 for the impact the factors had on their own overall sense of well-being. So these factors were family conflict, paying tuition fees, and obtaining a desired GPA, among numerous others. So just a few findings of the study were that the factors grouped by researchers as socioeconomic factors, so employment, paying tuition, and access to health services, were found to be commonly strong predictors of moderate stress and anxiety scores. Additionally, there was a relationship observed between students aged 25 and under and rates of anxiety. So this was interpreted as being due to how this particular demographic generally experiences higher levels of uncertainty about their futures and careers compared to older and postgraduate students.
Now going to discuss management techniques for anxiety, and these techniques can be applied by university students or anyone. In terms of more everyday anxiety reduction techniques, Rethink.org outlines some helpful practices that you can implement into your daily routine to improve your mental health and anxiety. The first practice that you can implement into your routine is meditation and being more mindful. This could mean that you meditate for 5 minutes a day and practice more gratitude. For example, you may have flowers, and taking a moment to smell them and appreciate them helps you to slow down and focus on the present and not on your negative and anxious thoughts. An extension of this advice could be that you keep a journal to record your times of gratitude. This means that if you face future negative thought patterns, you can review your past times of gratitude to assist you away from any negative thoughts and ruminating. CBT-based therapy techniques, cognitive behavioural therapy, can be applied at home also. This therapy involves recognising and challenging negative thought patterns to help break the cycle of ruminating and anxiety or stress. You can question yourself amidst a negative thought. Is your thought realistic or are you ruminating? And challenge your irrational thoughts and aim to replace them with a rational thought. Practice this method. For example, you may be worrying that your assignment that you submitted wasn't good enough, but you could replace this thought with a more rational logic. For example, you worked hard and your assignment was to the best of your ability. However, if you're unhappy with your grade, you can speak to your academic advisor about how to improve next time. You can also reflect on your personal or work relationships and how they affect your anxiety. Whether you need to practice making boundaries in these relationships by taking time away from people to self-regulate, or deciding you would benefit more from talking to family or friends about your anxiety, be better at deciding what might make your anxiety management better or worse. Further advice provided by Rethink.org included making sure you get regular exercise, sufficient sleep, and eat well enough. This is because satisfying your basic physiological needs is sometimes all you need to make the difference in your mental health. I will also briefly outline that if these management techniques don't help to improve your anxiety, you may want to seek therapy. Treatment or therapies that can be received through attending therapy include CBT, cognitive behavioural therapy, which is one of the most researched therapy techniques, as outlined in Curtis et al. 2021, and discussed previously, focusing on restructuring a client's negative thinking patterns, i.e. their anxiety and stress cycles.